Hello, I'm Tom Henry with Stone Rudolph and Henry, and we've got some very good information to share with you today. We've got with us today Josh Hunter of Takacs McGinnis, and I wanted to, rather than read through all his credentials and his title is Public Benefits Specialist, but just give you just a little background on my experience with this topic. I've helped two family members enroll in supplemental insurance, and once was several years ago, and it was a very painful experience, to say the least, a very complex topic. And then more recently with Josh's help. So that experience was totally different, and we are very happy to bring this information to you guys. Hopefully it'll save you a lot of money and inform you on how this whole process works, because I think there's a lot of misconceptions out there. So with that, I'll turn it over to Josh.
Thanks, Tom. I hope everybody can hear me today. One of the first things I would like to throw out to you is I hope this presentation is interactive. I hope you guys talk back with me and ask questions as it comes up, because we're going to cover quite a bit today. And I'm sure there's going to be something hopefully you haven't heard of before. If that is the case, please look in your menu there to see your chat feature. You can send those messages in. Tom will make sure I know what those questions are. We want you to be involved in this. So just like he said, I'm a Medicare specialist here at Takacs McGinnis Elder Care Law. My job as a public benefit specialist is to help our families with Medicare and with VA benefits, but we're just talking about Medicare today. That's enough of a topic for one video. So to jump into this, we're going to be talking about what you need to know about Medicare. So let's get on right to the first thing here. So first of all, the big question, right, is what is Medicare? Many of you may have a good idea that it's an insurance for people who are older, but it's a little bit more than that. And there's a little bit more you need to understand to make sure you're making the right choices. So the first thing is it's a health insurance for 4 groups of people, not just those that are older, but it is those that are 65 and older, right, and have paid into the system, under 65 with certain disabilities for 24 consecutive months. So that means an individual gets disability and has that for 2 years, or they were back awarded. And then it's any age with end-stage renal disease. That was something actually President Nixon had put in place, specifically due to the fact that transfusions can cost so much. Now, and it's any age with Lou Gehrig's disease, just because of how expensive that type of care can be as well. So those are your 4 categories. Your top 2 are the ones you're going to see the most often, right? Those 65 and older, and people who've been on disability or will be on permanent disability. So this comes through CMS. We refer to it as CMS. That's the Center for Medicare and Medicaid Services. It used to be directly connected to Social Security. Now it's kind of a sister program. It has separated on its own and grown exponentially over the last couple of years. So let's move on then. Let's talk about there's kind of 2 roads with Medicare, and I'm going to talk about both. The first road is original Medicare, and then the alternative is Medicare Advantage. And we'll talk about the benefits, the pros and cons of both, but we're going to start with original Medicare first. Original Medicare consists of 4 different parts, 4 things you need to consider. Medicare Part A and B, you've probably already seen because that's on that card you get in the mail from Social Security, right? So Medicare Part A, I want you to think inpatient. Now it's not that clean cut, but that's really typically what it refers to, right? So your hospital visits, your long-term care and things like hospice, you know, if you were to need skilled nursing, these all usually fall under Medicare Part A. Now Medicare Part B, I want you to think outpatient. So when you go to your doctor or you get durable medical equipment, that's an easy way to think of how they're different. Just so you know, for practical purposes, they do overlap sometimes, but that's the easiest way to understand what's going on. Now, Medicare Part A, the one for inpatient, is typically premium free if you've put in 40 quarters into your system, right? So what that means is if you have worked 10 years and you've been paying into your taxes, usually you don't have to pay an additional premium for Medicare Part A. You qualify for it whenever you qualify for it. Just one little fun caveat in that, if you have not, sometimes we'll say we see spouses at home who haven't fully put in their time. You can draw quarters off of family members and spouses. So maybe mom is able to qualify for Medicare because dad had excess. You know, maybe he's worked for 30 years. So he has all kinds of those quarters into the system. So sometimes she'll draw off of him or vice versa. Now, Medicare Part B has a premium for everybody. It's not about what you paid into the system. This year, it's about $145 or $144.60. It's going to go up this next year. We always see it kind of move with the increases for Social Security. So if Social Security goes up, your Medicare Part B is probably going to go up a little bit too. So that's not all bad. That's just one good key expense you know you're going to have and you need to consider if you get Medicare Part A and B. Now you can choose to decide which one of these you pick up and in what order. For example, you can get Medicare Part A standalone. You know, you could choose to deny your Medicare Part B. You may or may not have a good reason for that, but we'll get to that soon. Medicare supplements, or Medigap, I always call them supplements because I don't like all the double language between Medicaid, Medicare, Medigap. I find that confusing. So I talk to them about Medicare supplements. This is meant to pay the 20% that Medicare Part A and B leave open, right? A and B cover 80% for your bills, typically if it's a Medicare approved service, and your supplements are meant to come in and fix that 20% so you're not liable for it on your own. Now you're not required to have a supplement, but if you don't, you are liable for that 20%. So supplements can be a big saver and you need to make key decisions in regards to what your supplement's gonna be. I'll give you some advice for that too. And then the final part for original Medicare is Medicare Part D. I joke this is the only sensible and easy, obvious part for Medicare. D is for drugs. So Medicare Part D is your prescription drug plan. Now these come through third-party companies that contract with Medicare, and I'm sure you've heard of them before, Humana, Aetna, SilverScript, things like that. So with those four pieces, that's what original Medicare is. Part A, Part B, your supplement, and Part D. All right. Let's talk about some things you need to consider here. Medicare Part A, I've tapped into this a little bit, but this is just so you have a visual. Hospital stays, obviously that inpatient stuff, skilled nursing facility care. So if you were in a hospital and you need rehab, that can be in a home or actually in a facility. Hospice care is a Part A benefit and an incredible benefit in that it can come in and provide a ton of services that's fully supported by Medicare. So if you have your Part A, hospice is covered. That's a wonderful benefit. Blood transfusions, that's a big one, right? We were talking about end-stage renal disease. I don't know if you've recently looked into the expenses for blood transfusions, but it's shocking, it's crazy. You see why people want to look at it. And yet again, I hit it one more time, think inpatient. All right, Medicare Part B. This is the outpatient coverage. So services from the doctors or other people you may see. Various tests, your diagnostic tests. There's a lot of what we call free tests that come from Medicare that are just not billed as part of your services, preventative services. That would fall under this. Your home health care, if you were to need that. Durable medical equipment, that's probably one of the biggest ones. So if you need braces or wheelchairs, things like that, that comes under Part B. And then some preventative health care services, I hit that already. I'll get ahead of myself a few times in this. And of course, yet again, think outpatient. That's something you want to know when you think Part B. Okay. So D for drugs, right? This is the simple one. So they're administered by those third-party companies I talked about. It's not from CMS themselves. It's not from Medicare. It's from another company that deals with them. It's only available to those with Medicare. That sounds obvious, but there's a reason I put that in there because some people just want to pick up the drug plans. It doesn't quite work that way. You have to have A and or B. I say that specifically. You have to have one of the two. All right. And then you must be enrolled in a plan to get coverage. That makes good sense. You can't just get on Medicare and not pick your drug plan and hope you have drug coverage. It doesn't work that way. You got to pick your drug plan by itself. And then you have two sources of coverage, right? So you have prescription drug plans. That's the actual standalone drug plan that goes with original Medicare. Or if you chose to go with Medicare Advantage, it's an all-in-one option. And don't worry, I'm going to dig into Medicare Advantage more here soon. It's its own slide. Okay, so let's talk about supplements a bit. This is one that confuses people, and this is one of your biggest price saving or expenditure moments with Medicare if you go with original Medicare. One caveat I'm going to make before we talk about this any further. You cannot have a supplement with Medicare Advantage at all. It's illegal, can't do it. So this is also administered by private companies. You may think Farm Bureau, Mutual of Omaha, AARP. These companies offer you supplement options, and it's meant to cover the 20%. A and B does not, like I said. And for whatever reason, the geniuses at Medicare decided they wanted this to be letters as well, just to get you extra confused. For example, you may hear somebody has Plan G. That's not one of the parts of Medicare. That is a supplement plan. So yeah, you have Part A, B, and D, and then you can have Plan A and G and F. And yeah, I know it can get real confusing, but that's why professionals are here to help. So just keep that in mind. Each plan has different coverage. Obviously, they're not just named different things because they all do the same thing. They're named different things because they cover you in different ways. And I'm about to show you a chart here in just a second that goes into that in a little bit more detail. And basically, the easy take home from this is you're going to pay more in your monthly premium for the plans that have a higher level of coverage, right? That makes sense. So the more you want them to cover out of that 20% Medicare doesn't, the more you're going to pay. All right, so let's look at this chart a little bit. Now, this is going to be outdated soon, but this gives you the idea of what's going on. So as you can see, if you look at this HDF column kind of in the middle of your screen, I don't know if you can see my mouse if I mouse over it. This right here, maybe you can't see that. But the point is, you can see that that covers the most, right? There's a check in every single box. And if you look down the left side of your screen, these talk about the things your supplement can cover for you, like your Medicare Part B co-insurance, your Part A deductible, your Part B deductible, and so on and so forth. One key thing to note, if you guys are taking notes, this is important. I've done podcasts over this. I've done YouTube videos and whatever else because I'm trying to get the word out. Plan F and Plan C go off the market this year in 2020. And that's a big deal. You may be on that, you may have that form of coverage, and you're going to be grandfathered in, which means you're allowed to keep it, and that's great. But the thing I want you to know is if Medicare is getting rid of a plan, it's not because they want you to stay on it, okay? There's a reason they're getting rid of it. And what they're gonna do is we're gonna see premium increases that spike over the next couple of years. These aren't the first plans to come off the market. I've seen it before. The way it's going to work, and let's talk about one thing you notice here in this chart. What is the difference in Plan F and Plan G? I'm going to try to use my mouse again, and you guys will have to let me know if this is working. But it's just this one box. That one box is the Medicare Part B deductible. It's a pretty small benefit. It's actually $189 a year this year. So the difference in those two plans is only that one benefit, but they can charge an increase in premiums in such a way that you actually lose money. And people have been losing money on this plan for years. They're just now realizing as it goes away and the premiums are going to spike even more that it doesn't make sense. The plans are not going to tell you this. And that's something I probably should have said before I even talked any further. I'm not a part of any of these plans. I don't work with a Medicare company. This is all unbiased counseling. I want you to get the most out of your coverage. That's my goal. And if there's only $189 benefit difference in these two plans, but you're paying $50 a month difference in those two, you understand you're not making any money. The plan is making money on you. I don't approve of that. That's not okay. This stuff is complicated enough, and no plan is going to tell you that they're doing this. So what I'm trying to say is you have to be your own advocate in some ways. You need to ask those hard questions or find somebody to work with like me who can help you ask these questions and make sure you're getting the most out of your stuff. You don't want to pay for a benefit when you're not getting anything for it, right? If you save $189 but you paid $400 for it, that's not good, okay? That's just not good. So as of 2020, Plan G is the best plan on the market. They're not selling F or C anymore. So if you or a loved one are on F and C, you need to figure out if you want to switch to Plan G. Now, I'm going to stay on this slide a little bit and talk to you about something here. Guaranteed issue rights. Of course, it's my next slide, but what I'm trying to say is when we talk about guaranteed issue rights, it's a special consideration that only really affects your supplements. This is something else I want you to take notes of. The public generally doesn't know this. When you first are eligible for Medicare, you get guaranteed issue rights as part of the Affordable Care Act. Now, we're not going to go into the depths of the Affordable Care Act, but what this piece does for you is that it gives you the opportunity to pick up a supplement without medical underwriting. That is a huge deal. It's a very, very big benefit. We used to have a time period where when people would apply for supplements and they would get medical underwriting, you could be just flat denied, not get any of the coverage you wanted, or get charged at such a high rate that it's not possible. I've heard over $500 a month quoted for supplements before. That's rough. I understand that some people can have some major health issues, but if you can take advantage of guaranteed issue rights, this allows you to lock in a great premium rate and not be subject to medical underwriting. It's a big deal, and I want you to know about it. Another key thing I want you to understand is you only get it once, okay? Guaranteed issue rights are when you're first eligible for Medicare. So you have to make a big decision between those two roads we talked about at the beginning of my presentation, right? Between original Medicare and Medicare Advantage. So if you decide to go down the Medicare Advantage route, there are some minor exceptions to this rule, but the idea is if you don't make good use of your guaranteed issue rights, you'll lose them. And I've always hated to have that conversation with people after the fact. Yeah, I used to have original Medicare, but I jumped into Medicare Advantage and now I want to go back, but you don't have guaranteed issue rights anymore. And you're going to now be charged likely much more for that same plan you could have got, right? There's no good reason for that. So take advantage of it and use it and tell your family members about it, make signs about it, whatever you want to do. But we want to get the word out about this benefit. Okay, so moving forward, let's talk about the other option here of what's going on. Medicare Advantage and is its own beast and its own thing we need to consider. So this is the all-in-one option for Medicare. Okay, so instead of having Medicare Part A and B and a supplement and a drug plan, it's all wrapped up under one third-party company. It's technically some of the same benefits, it just comes from a different provider. So Medicare would contract with a company like Blue Cross Blue Shield or Humana, you've probably heard about, and you get all of your benefits through them. There's no standalone pieces you get to pick. You're not allowed to have a supplement, and you don't get to pick a separate drug plan, okay? Now, they often have lower premium rates, so that's a good thing. It does not change that you pay your Medicare Part B premium. That does not go away. And if you have a Medicare Part A premium, that does not go away either. You're still paying for that. But some of them have little or no standalone premium at all. For example, Blue Cross Blue Shield Sapphire plan, very popular in Tennessee, does not have a standalone premium on its own. So that's a big benefit, and they lure a lot of people in with that, and that's good. Now, they do not require medical underwriting. So you can see those people who didn't take advantage of their guaranteed issue rights or have a lot of issues or they're trying to change plans late in the game, you can see why this is appealing, right? Because maybe they wouldn't be able to pick up a supplement or they'd be liable for that 20% that Medicare doesn't pay. And that can be rough. Now, of course, I'm just going to reiterate, if you guys have questions about what I'm talking about or what I've talked about so far, please throw it in the chat because I know we're talking about a lot of stuff. One key thing you do need to know about Medicare Advantage is you have to have A and B. It's not an or. You have to have both. And of course, that's because it's an all-in-one option, right? You can't try to be clever and just pick up your Part A and try to get the all-in-one option. And no, I've heard people try to do some clever stuff with Medicare, and sadly, they've thought of that one. So you have to have both. Now, your Medicare Advantage plans are still on Medicare. And what I mean is you're still a Medicare beneficiary. You just get your coverage in a different way. That's important. Okay? You still have your Medicare rights. Yes, sir.
Question posed for you.
Sure.
When does it make sense to make a change between those two major choices between Medicare Advantage and original Medicare?
Yes.
After you've initially selected one, when would it make sense to change your option, and how do you do that?
Well, that's a good question. Somebody's looking into the future about what some of these slides are going to say. But the first thing to think of is when your situation changes. And I know that's vague, but let me put it this way. Sometimes we see people who are very happy with their Medicare Advantage plan. They've had it for years. But now mom needs to go into a facility. And the biggest deal when we're talking about Part C or Medicare Advantage is look at that last line. You have to think about networks. So if the facility that she's moving into doesn't take the plan, she likely will have to switch back to original Medicare. So we have to have discussions there. If we're talking about it the other way around, sometimes people are just sick of paying for their supplements and they decide they want to look into Medicare Advantage, right? They want those lower expenses. They don't want to have to deal with those additional premiums, which I understand. But it's very important that you have an individual who understands both original Medicare and Medicare Advantage and will actually give you an honest breakdown of the pros and the cons of what you're looking at. Sometimes they can lure you in with bells and whistles both ways, and you really need to consider what all is going to be changed by making your change. So I know that sounds bad and it sounds like the lawyerly answer, but it does depend. You know, it depends on your situation and what's going on. That leads me right into this last point here on this slide. Medicare Advantage, the biggest absolute thing, I want you to write it in big bold letters on your notes you're taking it home, is I want you to think networks, right? So with Medicare Part A, we're thinking inpatient. Medicare Part B, we're thinking outpatient. D is for drugs. We know what supplements do. And now Medicare Advantage, I want you to think networks. Now what that means is it limits who you're allowed to see. So that's the reason why you pay less for these plans. So you can go to certain doctors in that plan's network and it fits under what your plan's description is. The reason this is so important is you can't go anywhere you want. You can't go see whoever you want. They have to be in your plan. And if you act outside of your network, you are grilled on expenses. And I mean, you can seriously be hit for up to 50%. Okay. So they can be great. But what I tell people is Medicare Advantage is kind of like a shoe. Either it fits you or it doesn't. There's no in between. And if it doesn't fit you, it can bite you and you lose a lot more money than if you had made a good choice with original Medicare. So you see how you have to know how to weigh those options? An individual who only sees 2 doctors a year and is very healthy may do very well with Medicare Advantage. If they're an individual who likes to do their research and know what's going on, you may save a lot of money with Medicare Advantage. But if you're kind of, I want to get my insurance and forget about it, and I just want to go see who I want to go see, and I travel around the country, and I'm not worried about checking all this stuff, Medicare Advantage can catch you in a bind. Okay. I hope that's clear, and I hope that makes sense. And if it doesn't, I depend on you to ask me about it. All right, moving on. So let's talk about some programs that work with Medicare. We've briefly gone over the 2 big roads. Now we're going to talk about some other benefits and tie-ins and things that are related. The first one I want you guys to know about is called LIS, or Low Income Subsidy. You'll likely hear it referred to as extra help from Social Security. Now this is an absolutely incredible program. When I spent my time working for the state, one of the biggest parts of the grants that I worked under was making sure people knew about these programs and if they were eligible to sign up and get these benefits. So let's talk about what they did. So the Extra Help program comes from Social Security, and it's meant to add like a coupon to your drug plan. And that can be Medicare Advantage or original Medicare's drug plan, right? Doesn't matter who you get it from, it's a coupon. Doesn't change what you get, just changes what you pay for it. Okay, so it pays for your Part B plan's premium. It can pay some on these deductibles, and it gives you lower copays. That's a great benefit. And what I mean when I say lower copays, I'm talking about seriously capped lower copays at the pharmacy. So we've all heard these horror stories of people who are paying $500 and $600 a month in meds at the pharmacy, but they don't have the money to pay for it. This is a program that can really assist people. It can come in and say, okay, your brand name medications aren't going to cost more than $9. Your generics are going to cost around $3, right? It's something like that. And you can save extreme amounts of money. Another thing I want you to know is you skip the donut hole. How many people have heard that phrase before? So the donut hole with original Medicare and Medicare Advantage refers to a time frame where after you and your company have paid a certain amount, you fall into the donut hole and you're forced to pay your way out of it. So individuals who have really expensive medications will often see a time period in the year when their expenses spike, right? That's essentially when their plan comes in and says, I've paid enough, it's time for you to pay some money into this, right? And then alternatively, our government made something called catastrophic care, where the government steps in and says, okay, this individual has paid enough and we're going to cap their expenses for the rest of the year. That's a wonderful benefit. What's even better is when you pair it with extra help, like we're talking about here. That individual is allowed to skip right over the donut hole and go right into the catastrophic benefits. Some of these people are completely zeroed out for the year. So you can imagine how an individual goes from paying $500 a month for their insulin to paying $8 a month, skips over the donut hole and has that capped at $0. Big, big savings, life-changing amounts of money for some people, okay? So what I want you to know is right here, that second portion where it says 150% of the federal poverty level. Anybody who's around that poverty line needs to understand that they can qualify for this benefit. They need to look into it. Now, there are resource limits. There is an income actual limit, but if you're anywhere near that, you need to ask questions. For example, for a single person, it's around $1,500 a month. It's a little over. For a couple, it's around $2,000 a month, but a little over. So if you're anywhere around that in your income range, you can qualify. Now, the resources they look at are stocks, bonds, savings, anything liquid. What they don't look at is the things that's required for you to live. All right, they're not going to count the home you live in, and they're not going to count the car you drive. But if you have multiple properties, obviously you don't necessarily need that to live. That could be held against you. Okay? All right, I hope that made some sense. Let's talk about the other side of it, the more advanced version, rather. Medicare savings programs are issued through your state's Medicaid. So for us, that comes through TennCare. Now, just so you know, as a big star when you're talking about Medicare savings programs, if you qualify for a Medicare savings programs, you automatically get extra help, right? It's an awesome benefit. And the reason you'll see right here is because their requirements are even harder than extra help. So that makes sense. If you're at 100% of the federal poverty line, you're also going to qualify for the benefits for somebody who is less than 150%, right? So let's talk about a little bit what these are. They kind of come in 3 tiers for you. I'd like you to think of it that way. QMB is the absolute best assistance you can get, right? That is the Cadillac of assistance programs, okay? So what this is meant to do is it's not only going to come in and give you all the benefits of extra help, it'll also cover your Part B premium, so that $144.60 we were talking about at the beginning, and QMB can also act as your supplement, right? Wow, I mean, that's crazy. That's a lot of savings for an individual. SLMB is almost as good, but not quite. The only difference is SLMB cannot act as your supplement, okay? SLMB covers your Part B, gives you all the benefits of extra help, but no supplement help, okay? Now, QI1 is exactly the same as SLMB, except that is money that comes from the state. So the reason I list these out differently is technically the QI1 program can run out of money. If that were to happen, those people may not qualify for help. It is extremely rare, but that is a difference. So the individual would never know the difference in QI1 or SLMB. They would just see SLMB because it's the same benefits. I just wanted you to know about that. In case you're the inquisitive type and you want to know what this stands for, QMB is a qualified Medicare beneficiary. SLMB is a special low-income Medicare beneficiary, and QI1 is a qualified individual, okay? Doesn't really matter. We always talk about it in these acronyms. So if you know, this is what I want you to take home today in your mind. If you're a low-income, low-asset, you may qualify for help through extra help from Social Security or these Medicare savings programs through TennCare, okay? Look into it. There's nothing to lose. There's no application fee, okay? It can make a big difference for you, your family, whoever. Moving on. There are some special considerations I wanted to talk about today. You thought I was just going to give you a quick overview of Medicare. No, we are digging in a little bit to the important stuff. So the first thing on the list is the Medicare Part B penalty. These 2 penalties I'm talking about here on this list I see all the time. They frustrate people, they frustrate me, and you need to understand how they work. So remember at the beginning of my presentation, I said you get to kind of pick what parts of Medicare you want, and there are pros and cons for that. Well, here's one of them. So the Medicare Part B penalty is 10% every year that you were eligible and you did not enroll, okay? Now the Medicare Part D penalty is different. It is not the same. It is 1% every month that you were eligible and did not, enroll. So 12% a year. So let me give you a little math problem. I know they probably promised you there would be no math, but here we are. If an individual chose not to enroll for 28 months, what do you think their penalties would be for Part B and Part D? Be quite different, right? Because it's only technically 2 years for Part B. So that'd only be 20%. But we're talking about 28% on Part D, right? So just so you know, that does act different and they shock people. Another scary thing I want you to know about the penalties, you notice where I underline permanent? They're forever. They don't go away. So people who sadly don't make their proper decisions with Medicare can get bit, and this lasts the rest of their life. Just to give you a real life example, I was talking to somebody not too long ago who was deciding that they wanted to get help on their own or do it their own way, or go through Social Security or whatever. And they got their drug plan and decided they didn't want to keep it because they were healthy. And Social Security told them, well, you don't have to have it. You can drop it if you want. Well, that's good and all, except for now they have a 115% penalty for the rest of their life. I'm going to let the silence sink that in a little bit. That's rough. That's really rough, and it could have been avoided, right, had they had true good advice on what to do. Yeah, there's a lot of things we can do in life, and I'm sure Mr. Tom understands that when it comes to taxes. A lot of stuff you can do, but very seldom is that the stuff you should do, right? So we got to make the right decisions with what we know, or find help when we don't. Now let's talk about supplements and medical underwriting. We've already tapped on that a little bit with guaranteed issue rights, right? But insurance companies can change your premiums up and down or flat deny you if you don't have guaranteed issue rights. So when I was talking about earlier, those people who want to switch from Plan F to Plan G because it's coming off the market, understand that you're going to go through medical underwriting. What's the most important thing to know about that? Well, we don't get any younger, and we typically don't get any healthier as time goes on. So your medical underwriting today is probably going to be about as good as it's going to get. Okay, so if you're wanting to change plans and you don't have those guaranteed issue rights, you need to go ahead and consider doing that now, and do not wait. Get good advice, talk to somebody who knows what they're doing, and get some help deciding what you want to do, okay, before you end up paying too much money. Yes, sir.
Got a question on this topic. I believe I understand what they're asking. What if you were covered by an employer health plan, and I believe they're referring to these two Part B or Part D
Yes.
penalty issues? How do they interplay? How do they interact?
Well, somebody was like 2 sentences ahead of me. That's awesome. So I was going to say the only way we avoid Part B and Part D penalties is if you are under what's called creditable coverage. Now, if I'm not crazy, I believe I actually do have a slide on this coming up soon. It's actually my very next slide, of course. But creditable coverage is a way that you would avoid those penalties. And I'm actually not going to get ahead of myself just yet, and we'll tap on that on the next slide. Let me finish this last portion out here. And it answers the question you asked me earlier, Tom, of, well, if I want to change, when do I change, right? That's this annual enrollment period. Now it's October 15 through December 7th of every year. This is super, super important, and I want you guys to know this and remember this date. I hope you put it on every calendar and circle it in red, because this is the one time period where both individuals on original Medicare and Medicare Advantage are allowed to make decisions about their coverage next year, right? So as we're coming up on this date, we'll be picking drug plans or Medicare Advantage plans for people in 2021. It starts January 1st, okay? I hope that makes sense to everybody, because this is important. Now, there are other enrollment periods, as I put a ... but those can get confusing. There is a Medicare Advantage annual enrollment period that starts, it is January 1 through March 31, and that only applies to people who are on Medicare Advantage. There's a general enrollment period that is January 1 through March 31. I know they have to overlap them to make them even more confusing. But what the general enrollment period is for those people who did not pick up Medicare Part, A or B, and they want to add those to their plan. So when you do that, that comes into effect July 1 of that year. And sadly, let's say in January or January or February, you decide you want to pick up your Part B and you haven't had it. Well, remember I said it doesn't go into effect until July 1. The premium keeps ticking, that penalty. So that's kind of a bummer, but that's something you need to know as well. All right, well, let's move into your most recent question. So what if I have other coverage, right? We have a lot of people who are over 65 and they're still working, or their spouses work, or whatever situation you may be in. Remember how I said I keep having these single phrases I want you to remember? If we were in person, I would be quizzing you right now. I hope that just lets you know what kind of presenter I am. But Medicare Part A, we think about inpatient, right? Medicare Part B is outpatient, right? Medicare Advantage plans, we think about networks. And supplements, we're thinking about those guaranteed issue rights. Now, when it comes to if you have other coverage, I want you to think about creditable coverage. That phrase is crucial. Write it down. Creditable coverage means that your coverage is comparable to Medicare. Now, the good thing is you don't have to do anything fancy to prove it, right? It's a letter from your current insurance provider to Medicare that says, yes, this is creditable, or no, it's not. And that is what will or will not establish a penalty for you. So the ultimate question is now, well, how do I know if it's creditable? Well, all you need to do is talk to your HR representative or your insurance specialist and ask each year. And I do mean each year. Don't just assume it was creditable last year, so it's going to be creditable next year. Medicare bites people who don't advocate for themselves. Okay, so take that little extra work and ask that one question. It's worth it. It's a big deal. Now, another thing I want you to know, when you ask that question, it's kind of a two-part question in that, is it creditable for Part B, as in boy, for outpatient, and is it creditable for Part D, as in drugs? Because it may or may not be creditable for both. Things to consider, right? They have two different penalties. The first thing that comes to mind for me is federal employees. Typically, they have coverage that is creditable for B, but it's very rarely creditable for Part D. And they end up with a drug plan, penalty, and they get all mad, and they're like, I was told it was creditable. And we say, well, you didn't ask all the right questions. And the craziest thing is, please know, I don't expect you guys to know all the right questions. That's my job. I spend every day doing this. But I want you to know what you don't know, if that makes sense. And be honest with yourselves. Don't assume anything with this, because these things can have lasting effects, okay? Good. So
Hey,
I hope that answered your question.
I got another question for you, which you may be covering later. But
okay,
I'll ask it
that seems to
anyway.
be the theme. Yeah.
Well, I think maybe your presentation's very thorough. Maybe that's the issue.
Yeah, no.
But anyway,
I paid them to ask these questions ahead. No, I'm kidding.
Someone who turned 65 in August of 2021, when do they need to enroll?
Ooh, good question. So what we're talking about here is the initial enrollment period. That's a good thing to add in your notes. So when you're first eligible for Medicare, what does that actually look like? We'll go ahead and hit on that now. But your initial enrollment period is 3 months before your birth date or your eligibility date if you're on disability, the month of, and 3 months after. So it's that 7-month window, okay? So if you get all of your enrollment stuff done 3 months before, or in that 3-month period, it will go into effect the first of the month your Medicare is active. So you said somebody had a birthday in August of next year. So they have 3 months before August to start setting up their plans if they want, okay? And then it would go into effect August 1, which is great. Now, if you set it up August 1, or you start picking all your plans in August, the earliest it will go into effect will be September 1, the first of the next month. And that rule generally follows if you wait. So I always recommend people are active during those first 3 months before your Medicare actually goes into effect. Now, of course, can't have a good rule without a caveat, can we? An individual who has a birthday on the 1st is actually a unique category. So let's say your birthday was August 1. Well, your Medicare would actually start July 1. That's the only exception. So if your birthday is on the 1st, it's actually the month prior, okay? So keep that in mind. That's important for those people. That changes your 3-month window a little bit. Good. That's a good question. That leads me into one more thing I want to cover before I move any further ahead. When we talk about individuals qualifying for Medicare based on your age, there's some things we need to consider. The first of which being, well, how do you actually start your Medicare? Okay, that goes back to our first slide. In that, an individual who is new to Medicare, if you're already drawing your Social Security benefits, let's say you started drawing at 63 or 62, whatever that may be, you don't have to openly enroll in your Medicare coverage. It's going to start when you turn 65, that first of that month. Okay, you don't have to do anything special. If you are not drawing your Social Security benefits, you have to directly contact Medicare and say, I want to sign up for A and B, okay? So those of you who plan on working until you're 75, 80, 95, 150, you need to reach out to Social Security yourself. Okay, and this is important if you decide to pick it up or not, if you have creditable coverage or not. Because even if you have creditable coverage, maybe you want to go ahead and pick up that premium-free Part A. Or maybe your coverage wasn't creditable, so you need to get your B and your drug plan in place. Okay, a little bit of homework. Or find somebody who knows the right questions to ask, and we'll walk you through it. Okay, good. Okay, a lot of things to consider. Your note page, you should at least be on your second page of your notes at this point. Okay, making sure I didn't skip a slide. So let's talk about some Medicare counseling services and what actually I do and what I provide. We've talked about the brief overview of what Medicare is, some programs that work with Medicare, and all of these various things you need to consider and know and questions and all that jazz, and I've got your head spinning. Now, what I am here to provide and what we're working with Stone, Rudolph, and Henry to do is to provide unbiased Medicare counseling. I'm going to provide my services to you guys, which is not typical. You are the first in which I've done this. I typically only provide my services to our clients here at Takacs McGinnis. Of course, I'm not part of a company. I'm not here to sell you anything. If your coverage is good, I'm going to tell you it's good and we can high five after, and good job on doing your research. But if it's not, I'm going to help you figure out how to fix what's going on, okay? And try to help you each year if you want in terms of picking out a proper drug plan for you. Something to know, you may be wondering, well, what if my Medicare is already in place? I mean, how much can you actually help me? You know, I did a good job. I've got my supplement. I love it. And what about my drug plan? It's hard to tell, and I'm going to be honest with that. As we talk to each other, we need to review at least your drug plan every year. Okay, it can be a huge difference. These plans are allowed to change anything they want from year to year. Now, what was that annual enrollment period that I'd put on the screen earlier? Of course, I'm assuming you guys are just yelling the answer and waving your hand at home. But it's October 15 through December 7. This is Medicare telling you, you have this time period to exercise your rights, do your homework, and tell us the plan you want. Otherwise, you're stuck in what you have. Okay, if you are stuck in what you have and your plan decided to change everything next year and their premium went up, their deductible went up, all of your meds tier lists have changed, they don't cover your meds, Medicare says too bad, so sad. You didn't exercise your rights, you didn't look into it, you're stuck in that plan and you're going to deal with the additional expenses. That's heartbreaking to me. That really, I hate hearing that, I truly do. And I'm not just saying that. It's something I hear every year. Somebody calls me in January or February and says, oh my gosh, Josh, hey, I went to go pick up my meds and it's costing me $300 more a month. I don't know what to do. And I'm saying, well, come October 15, we'll talk about it for 2022. And that really stinks. It really stinks. So some people will come to me and we'll check on their plans and we may not save you any money. You may be on the best plan for next year. And I'm going to tell you that. And that's great, and that's good, and we'll high five after, like I said. Or your plan may have changed stuff, or your medications have changed, your situation, your health, and you need a different plan, and you can save substantial money. I'll put it to you this way. I am one man at a relatively small elder care law firm, okay? In the last 2 years, I have saved $250,000 on drugs alone. You heard that right. Over $250,000 on meds by themselves. I have not talked to 250,000 people. So those people, you know, on average are saving some money. You may save $500. You may save thousands. I'm not sure, but we need to do our homework and check, okay? Please know that if you use me or not, I want you to do your work. I want you to have the best coverage you can. You worked for this. Let's get it right. Okay, moving on from that spiel. Medicare Coordination of Benefits Assistance. What that long sentence means is I want to make sure that if you're new to Medicare and you don't have anything in place, or you've been on Medicare, you're getting the best coverage you can and it's working with your situation. If you have other coverage, if you don't, if you have all these various health problems or special medications, we want to make sure everything works. I don't care what it looks like on paper. I care what it does for you and your family. Okay? Good. Assistance with Part D and Medicare Advantage comparisons and enrollment. That's as simple as it sounds. During this annual enrollment period, I hope you guys call to schedule an appointment with me. We can sit down in person, we can talk over the phone, whatever that needs to be to make sure you get the best drug coverage or Medicare Advantage plan for you next year and save that money I was talking about. It's a big deal. Okay, and then finally, application assistance with any of those programs I've talked about, the extra help, the Medicare savings programs. If there's prescription assistance for your specialty medications, we can talk about that. Whatever that may be. The only thing I can't do is sign you up for your supplement. That's my one limitation. Based on my licensure and all of my stuff, supplement companies don't like talking to me because I don't work for them. I'm not there to benefit them. They cut me out of it. I truly believe that's what it is. But I can give you all the advice you need to pick your plan before you ever call them. I can talk to you about who to call. I can talk to you about everything they tell you on the phone. I just can't do that one enrollment myself. I can help you with Part A. I can help you with Part B. I can help you with your drug plan. I can help you with Medicare Advantage. All these things. I can help you pick your supplement, but you got to do the enrollment. Okay. So, of course, what's the next question of, well, how much am I charging for what I do? What our specialty rate is going to be for individuals with Stone, Rudolph, and Henry is a base rate of $100 or $100 an hour. More than likely, I will be able to get your review done in less than an hour. Okay, I worked for the state. It was my job to get people in and out and get it done timely and make it as understandable and quick as I could. That is my goal. Unless you bring me some crazy, hairy appeal situation and all this kind of craziness going on, I imagine we could get up for that $100 base rate. And I truly hope that in at least our drug review, I save you more money than that. That is my goal. I hope you all make money off our interaction, but we'd have to see what happens. This is the part where I particularly imagine you guys would have some questions, and I hope you're just blowing time up. Do we have anything popping up over there?
No, but you raised a question that I wanted to ask.
Okay.
On the, you mentioned that it would be an annual service, mainly due to, if I understood you right, prescription drug coverage.
That's the thing that people review most often. Yes, sir.
And what would cause someone to change their plan that they've had the previous year if they were happy with that plan that they've been using?
Well, remember what we were just saying. That's a good point is, well, why do you want to change it if it's been working? You know, don't fix it if it's not broke. Well, that's because there's things that change outside of your control. If you're happy and healthy and you're doing good and nothing has changed, that does not mean the plan will not change. The plan can change anything they want from year to year. And if you do not take advantage of this time period, you're stuck with it. And they do change. They change in very big ways. Let me put it this way. My mom has been on Medicare now for 6 years. She hasn't stayed on the same plan twice.
Oh, wow.
She hasn't changed that much. But when the plans change a tier or two on medications, that tier change alone can be $50 a month on one med. So by doing your research, you can save some good money. There have been some years she saved $150 for the year. No big deal. There's been other years we've saved in excess of thousands. You've just got to look because we don't know. Now, the other part is if your situation actually changes and like you get on brand name meds or, you know, your health is declined, well, you may not be a good fit for that plan that you've liked anymore. So it can change in two ways. I hope that makes sense. The plans can change, you can change, right? Regardless of if your plan this year was good, bad, or ugly, I want you to know that we need to be careful about checking what's coming up for next year, okay? That's good.
Okay, I've got a question posed here. If you're enrolled in Part B, how do you know which letter you have? I believe that means plan letter.
I think we're talking about supplements.
Okay, so those are two different things.
Yeah, so
okay.
Yeah, it sounded like an interesting question, but let me try to phrase it this way. Your red, white, and blue Medicare card, your actual paper Medicare card will let you know if you have A and B, right? Those are the parts of Medicare. If you're wondering about your supplement plan, the easiest thing to do is look at your card. You know, you may have a card from Farm Bureau and it'll say, you know, Plan F or Plan G or whatever that may be on your card. Or of course, if you've lost your card or something like that, you can get those replaced. Medicare cards are replaced through Social Security. Your plan would have to replace your supplement card, or if you wanted to talk about what plan you actually have and you don't have your card, that's how you'd find out.
Okay. One thing, having worked with you on someone applying for the first time,
Yeah.
and that's why I have a gap in knowledge on someone that you're reviewing, because I've not worked with you in that situation. But on the initial look, I found it quite interesting that the level of detail that has to be there on mainly the drug plan. So I remember you were looking up individual drugs, not only for who had the best premium for this combination of medicines that someone needed, but also which pharmacy was involved with the best pricing. Could you talk a little bit about
Of course.
pharmacies and how
Yeah,
that works?
that's a good way for me to kind of talk about what we're doing for my annual enrollment reviews. That October 15 through December 7 works very similarly to what he's describing for somebody who's new. So when we're talking about picking your coverage, particularly with your meds, I need to know what meds the individual is on, what your preferred pharmacy is, and various other details to make sure I'm truly understanding what your expenses are going to be for that year and can truly gauge what is the best move for you. I compare the plan's premiums, that's the annual amount you pay each month. I talk about their deductible, if they have one, and that's the flat rate you have to pay before they start paying. And I talk about co-pays at the pharmacies. And I cycle through various pharmacies to make sure we're finding the best deal for you and you know what's going on in your area. The way I do this is my licensure gives me access to Medicare's website. I can get in their details and see what's going on. And in doing so, I'm able to compare all of the drug plans that have turned in their information to Medicare. Not any one company or another, but every plan that is issued through Medicare. So I can compare them all side by side, unbiased, and say, you know, this plan is going to be this much, this plan is this much, here's the difference, what would you like to do, and here's my recommendation. So that's the easiest way to understand how it works, and that needs to be done every year for every person, at least that much. Just because you don't know what's going to happen in 2021, I don't know what's going to happen yet, and I do it every day. So that's a good question.
I also recall, being surprised by that in the situation you and we looked at together, that a local pharmacy actually had better pricing than the national chains. Is that something you encounter often?
It's hard to say. It's so individualized, and what I mean is, what medication is the individual on? Where do they live, and what are their local, pharmacies? And what does that pharmacy choose to communicate to these plans, and what deals are they going to have? Is it a preferred pharmacy or not? It really does vary. But the one consistent thing I can tell you is that, you have to do your research. You need to plug in that individual stuff into the system to see what's going on. We often hear where people will come in and say, well, my neighbor's got a great deal with this plan doing this, that, and the other. And I'm like, that's fabulous for your neighbor, but are you taking the same meds? Do you go to the same pharmacy? Do you have the same health concerns? And when those answers start becoming no, you start realizing, well, you don't have the same situation and you need an individualized plan. Even in spouses, me and my husband, we've been on SilverScript for 10 years. That's cool, but one of you or neither of you may need to even be on that plan. Brand loyalty and Medicare don't connect. They don't work that way. You have to do your research to get what's cost effective for you today with what's going on with you. Okay.
So if let's say you're working with a new client to you, but they had already enrolled in whatever they were going to enroll in, including their drug plan.
Yeah.
What portion or what percentage of those do you typically see that you suggest a change? I mean, how many are right where you think they should be compared to how many you suggest changes to?
A lot of them actually have a good overall plan in terms of like if they went original Medicare or Medicare Advantage, but it's more of them tweaking it to fit their situation. So it's not real common that people come in here and need a complete overhaul, but maybe they haven't done their drug plan research and this plan saves them, $5,000 next year. That's a big deal. Or maybe they're on Plan F. They've loved Plan F. It's been great, but we were just talking about how it's gone off the market and the premiums are going to skyrocket. So that's not going to be cost effective either. I have some clients who otherwise I would say had incredible coverage. You know, they'd set their stuff up really, really well, but they were paying $60 a month too much on their supplement. That adds up. That adds up quick. It would have been even worse in subsequent years. So going to a different question of how many people come see me and make minor changes is actually a pretty high percentage. I would say every bit of 60 to 70% of the people I see don't stick with the same plan each year in terms of at least your drug plan. There's minor tweaks that come up each year, either because your situation has changed or the company and the drug companies have decided to change what they're doing. So either way are reasons to make adjustments.
Another question sort of along those same lines, because this is until I started speaking with you and understanding more how this works, I think I had a misconception that you probably, well, let's see, may have run into. But if someone had been enrolled in their plan for several years and then came to see you for your services, do most people think that you get that drug supplement once and that's it? You've made your choice and you just keep going with it year after year?
Yes. Yeah, you're right. Most people believe, well, I picked my A and B and I've got my drug plan and my supplement and I've got my one coverage thing and I just coast along. If it's good, I don't want to rock the boat. And what happens to those people is as these changes occur that go under the radar for typical people, if you're not a professional, you may not notice it. Those people just end up getting stuck with increased price after increased price after increased price, and it's not fair, you know. And then Medicare tells those individuals, well, you didn't take advantage of your enrollment periods, you didn't do anything about it, so oh well. And I feel really bad for those families. You know, they've lost a lot of money and will continue to lose money until they either get help or choose to dig into this so deep that they actually know what's going on.
So do the drug plans, when they change, do you typically see price creeping, or do you see big changes all at once?
It really does vary. I know that's not the answer you'd want, but sometimes a plan will add 50 cents to their premium next year. That's no big deal. Sometimes they'll just change around their tier 1 and 2 medications or the smaller meds. But other times they'll come in and completely rewrite their plan and go a different direction and jump, you know, $15 a month in their premium and completely rewrite their formulary that may or may not cover the brands you're on. And your tier 1 generic that was $1.50 may become a $5, you know, tier 2 generic. And that doesn't sound like a lot by itself, but when you start adding stuff up, we can talk about money in the course of a year that could be avoided. Well worth more than my services.
Right.
So that's the way I
very much appreciate your time. It looks like we're running out of time. One thing that I would mention to everyone that's on the call, again, I've worked with Josh with a family member, and if you want a recommendation, I've also referred family members to him. So I very much think his service is well worth what he's offering it for. I will also mention that you know, they're not located in Clarksville. They're a little bit a little bit out of town, but not much. But he was able to help me with a situation we worked on together, totally by telephone. And of course, it was more in the COVID period than it is opening up a little bit right now. But I don't think we lost anything in working it that way. Did you, Josh?
No, sir. I can do stuff totally over the phone. When I was working for the state, we were helping people out in rural nowhere, and that's just the skill you have to have. So we can do it over the phone or in person or whatever is your comfort level. We can make things work out for sure.
So if you guys want to follow up with that, I don't know, do they have contact information available to them? If not, it's they go to just Google Takacs McGinnis or Joshua Hunter. Takacs is spelled T-A-K-A-C-S.
Yeah, let me go back to my first page here. Maybe that'll help.
Yeah, that'll help, because
sorry for the flash warning on the screen.
Yeah, if you can reach him that way. And
yeah,
I think
so I work at Takacs McGinnis Elder Care Law. My direct phone line should be on the website. If you want to call our office and say, hey, I'm with Stone, Rudolph and Henry, and I want to talk about Medicare counseling. They're going to put you through to me, and we'll talk about getting that 1 hour, scheduled. And if we need to do more than that, we can do more than that. Whatever that needs to be for your situation. What I will end up needing from you, I have a little workbook and, just some forms saying that, hey, you're allowing me to work on your Medicare. I'm not some fraudulent person setting this stuff up, and you understand what I'm here to do. Pretty easy. So.
All right. Well, thank you so much for your time today. And I think I like to be able to help people with services where they know most of the time, at least, they're going to save more than it's ever going to cost them. And if nothing else, have peace of mind that they're on the right track. So thanks very much.
Yes, sir. Thank you, Tom. Thank you, everybody. Hope to hear from you.